Morning, everybody. This is Alison Scott. We're doing this teleconference live with our Orange Botswana communication devices, and it's a way to demonstrate how we can use cell phone technology for mobile health in Botswana. As you can see, we've picked Botswana as the country that we're doing our social health initiative in. Botswana is in the southern part of Africa, as you can see on the slide, and the business climate in Botswana is probably one of the safest in Africa. According to the World Bank, Botswana is one of the best countries for the ease of doing business. So Botswana has a population of 1.92 million people. They're predominantly in the eastern part of the country because 80% of the country is covered by desert. Botswana has been a stable democracy since 1966. Botswana is also the highest ranked country in Africa on the Global Peace Index, and it ranked the least corrupt country in Africa in 2005. Now, Botswana is also a middle-income country. It has a very strong diamond mine sector. Now, despite the middle income, there's still a number of poor people living in the country. The government has been making very discreet efforts to improve the economic diversification of the country. They have an economic development plan that has 10 features. These are economic diversification, job creation, poverty alleviation, public sector reform because there's concern in the country about nepotism, rural development, human development, technology development, and today I am so happy to be speaking to you by cell phone because cellular phones have really opened up technology in the country and connected people that have had no other previous way of communicating. Over 95% of the country can access communications through simple cell phone technology. Botswana has also been making efforts to improve their infrastructure with their roads and particularly with their power sector, which I'll speak to later on in the presentation. The intent of the government's economic plan is to create a strong finance sector, which will improve trade relationships. Now, this country already has very good trade relationships through its trade agreements, but they want to do better. So, what are some of the challenges? Well, the last recession really impacted the economic growth of the country. Since this is a single industry mining sector, with diamonds as a luxury, the last recession really impacted sales in the country. And what we saw were some serious rising unemployment numbers, and the credit rating was downgraded to an A- in the country. Now, Botswana has always had problems with consistent power, particularly in rural areas, and it's relied on South Africa to provide most of its power. Recently, the country has been investing in power development, and there's some exciting new projects coming forward which should make this more sustainable. Another issue in Botswana is the lack of skilled, reliable workforce and some of the social conditions there, and that's really what I wanted to talk to you about today on the phone. The prevalence of HIV transmission and AIDS is very significant in this country. It is the second largest prevalence in the entire world. And we're about to embark on a new social enterprise initiative that will change that. So, key industries, as I've said, are diamonds, agriculture, the government really wanting to bring tourism into the country, but how can they do that if the pervading social conditions and risk of AIDS are difficult? If they want to capture the exclusive tourism industry, they need to pay attention to the health issues. So now I want to talk about telecommunications. The rapid growth in this industry makes it a very, very strong sector to be considering a new social enterprise initiative. I'd like you to take a look at your computer screens while you're listening to this telecommunication on the prevalence of AIDS, and you'll see exactly what our initiative is about today. If you take a look at Botswana, which is in the center of the bottom of Africa, you will see the prevalence of AIDS, and you'll see the growing issue across the entire continent. There's no way Botswana is going to do well economically unless it tackles this serious social problem and health issue. So here's our project. If you're looking at the screen now, you will be able to see where you fit in, because you are the Student Reach International volunteers that are going to be traveling to Botswana with us to to introduce this new social enterprise. We are going to be working with the telecommunications firm Orange Botswana. The Botswana mines through Orange Botswana and Botswana are going to be supported by government funding and M Health Alliance funding to be able to provide health initiatives to young women between the ages of 15 and 29. What we're going to be doing, what you will be doing specifically when we land in Botswana, is meeting with young women from all sectors of life, both in the rural and in the city areas, and providing them with handsets and teaching them how to use the cell technology to download their important medical health records. They will be able to log in, track their health treatment plans, and then they'll be able to receive feedback directly on how they're doing with their drug treatment plans. In addition, we'll be able to provide critical information to them about HIV transmission and health prevention. Now, that's how we're going to start. But with you and your community development initiative, by meeting the people on the ground and communicating with community stakeholders, what we're really encouraging is the young women to be able to use texting, to be able to start web support groups and support treatment interventions by being able to provide specific text messages about very simple sexual transmission issues that young women can attend to. Culturally, these are difficult things to talk about. It's easier using the web technology, it's easier using cell phone technology, and it's also the fastest growing sector in the country. So for this age group, we're hoping that they'll be able to access as a tool to look after their health. So, why are we doing this? We're doing this because there's been another project that has been very successful around electronic health records in the country. Now, we have to be careful going in that we're learning by what we're doing. So we're going to be talking with you each week about some of the unintended consequences that you see and some of the benefits. So my recommendations today, folks, as we consider this plan and moving forward, is that the positives outweigh the risks. There's an immediate need to address HIV transmission in this country, and our social enterprise model is the way to do it. The community's ready, we're ready, so let's go. Thank you very much for your time. Signing off. Take care. Alison.